Thank you, Mylène. Thank you, everybody, to be here. The aim of my talk is to report some data from Toulouse about the hospitalization of the nursing home resident in France. So I've got some data about this flow of patients between the hospital and the nursing home. And I will first give some background about what we know about this population and what's happened when they go in the hospital, mainly to the emergency room. And after that, I will report 2 interventions that we have implemented during the past year around Toulouse, trying to reduce the rate of inappropriate hospitalization of the nursing home residents. When the resident arrive in a nursing home, most of the time, the resident and the family believe that it is time to rest. But the story is not exactly a very calm story, because most of them will be hospitalized many times during the last year of life. And for example, in the ICAR study, which is a large randomized controlled trial that we have performed around Toulouse, we observed that about 30% of the nursing home residents were hospitalized at least one time during the year, and mainly at the emergency room. And I will come back to that, because this is something important to take into account when we want to avoid inappropriate hospitalization of the nursing home resident. So this is a high rate of hospitalization, and the same rate of hospitalization is observed in the literature. Between 20 to 65% of the nursing home residents are hospitalized in the North American country or in Europe. And the mean numbers of transit to the emergency room per year is around 2 in the United States. So it's a very high rate of hospitalization for these people. The rate of hospitalization in France is quite stable during the past decade. As you can see here, this is some data from the area of Toulouse, and the rate is around 30%. So it is quite stable. It's high, but quite stable during the past year. But when we do a focus on the numbers of people hospitalized at the emergency room, you can see that it's growing very fast. So the ratio of patients sent to the hospital through the room of the emergency is growing very fast. One could expect that these growing numbers of residents sent to the emergency room is related to the local health resources. For example, the presence of geriatrician in a local area, or the distance between the emergency room and the nursing home. But we didn't find any correlation about this health organization and the rate of hospitalization to the emergency room. But on the other hand, we have observed that this rate of hospitalization was very specific to each nursing home. And you can see in this figure that each column corresponds to one nursing home. So all the nursing homes represented here are located in the same area with the same health resources. And you can see that the rate of hospitalization can vary between 10% and 50%. So the residents are the same, the health resources are the same, but the rate of hospitalization is very different. And when you go to the patient hospitalized to the emergency room, the difference are even higher, between 20 to 90%, which means that in some nursing homes that face an acute disease, the resident is systematically sent to the emergency room. And on the other hand, some nursing homes seem to have a specific organization to avoid this hospitalization to the emergency room. The problem beyond the hospitalization of the patient is that there are some balance between the risk and the benefit to be hospitalized. When the nursing home staff send the patient, the resident, to the emergency or to the hospital, there are they expect some benefits such as the follow-up, some expertise, some exam. But we know that at the same time, they will have a risk of adverse event. Most of the nursing home residents who arrive at the emergency room or at the hospital will have delirium, iatrogenic event, falls, immobilization, restraint, and many bad events. And this event seems to be even higher when they arrive at the emergency room. So the balance between the benefit and the risk seems in favor to take care of this patient inside the nursing home. And we've got now some data that support that in case of pneumonia, the risk of mortality is higher when the patient, the resident, is sent to the hospital. So this is something we need to take into account when we consider to send a patient, a resident, to the hospital. To have a better understanding of this transition to the hospital, we have performed the Pleiad study. The Pleiad study was performed about 4 years ago. It involved 300 nursing homes, 2,000 residents, and we have asked the nursing home staff about the moment, at what time the resident was sent, why was it sent, what's happened, in fact, before going to the hospital. And what we have observed is that most of the time the resident is sent to the hospital in the condition of emergency. Most of the time because a disease exceeds the resources of the nursing home. The good news is that most of the time the decision is made by a physician, the GP most of the time, but also other GP who are involved in the care. The black side of all this is that most of the time the decision is rely on someone who is not directly involved in the plan of care. For example, it can be a general practitioner who's not aware about the condition of the patient. It can be the 911, and it can be many other people working in the nursing home who can take the decision to send the patient. And of course, there is some problem there because they may not be aware about what is the best and what is the good balance between doing the care in the nursing home or sending the patient to the emergency. The patients sent to the emergency room are most of the time disabled. As you can see here, the distribution according to the ADL score. Most of the patients are disabled with an ADL of 1 to 4, and 42% have an ADL of 1 to 2. So very disabled patients, and most of the time they've got dementia and Alzheimer's disease. And what we have observed in this study is that very frequently the numbers of patients who come back to the nursing home after an hospitalization are more disabled than they were at entrance at the hospital. And this is the same observation at for the demented patient and the non-demented patient. Of course, they can be more disabled because of the disease, but we also know from other studies that most of the time they are more disabled because of iatrogenic event, because of the folly, because of the immobilization, because of bad events, because of the drugs, psychotropic treatment at the hospitals. So these are the main, these are the consequences of the care provided by the hospital to this patient. The question for the nursing home staff is to know whether this hospitalization is appropriate or not. It can be inappropriate because there is a palliative care, there is a do not hospitalize directives, there is no severity to send the patient to the emergency room, and even when the hospitalization is appropriated, it can be also potentially avoidable. For example, when a patient is sent for dyspnea because of heart failure, it can be appropriated because of the dyspnea, but it can be potentially avoidable because the treatment is not perfect. It can be better. So the problem at the moment in France is that we don't know exactly what are the factors that influence the hospitalization who are inappropriate or potentially avoidable. And so we are currently performing it's an ongoing study at the moment, but we want to have the whole picture of what's happened to this resident. So this study is performed with the emergency room of all the Toulouse area. We are already included about 400 residents. We will have at the end probably 1,300 residents included in this study, and we will have for the first time the whole picture, what's happened before admission to the hospital, what's happened in the hospital, and what happened after that. So we will have the whole story. And what I can say for the moment, for the first resident who were included in the pilot study, is that about 43% of these residents can be considered as inappropriate. It's an inappropriate hospitalization because there is no vital symptoms, because these residents are already in palliative care, and so it's probably not the good thing to send them to the emergency room, and they do not hospitalization order in the charts. Just in a few minutes, I will just report very quickly two interventions that we have organized around Toulouse. There are some recommendations that have been sent to all the nursing homes around Toulouse to avoid the inappropriate hospitalization of the resident, and most of these recommendations rely on the common sense. Do the vaccination, for example, avoid bad treatment and medication, psychotropic treatment, and so on. Our point of view is that an important intervention that should be implemented is to improve the network between the nursing home and the hospital. And for that we have performed the ICAR study, which is a randomized controlled trial who assessed the impact of a network between nursing home staff and hospital geriatrician. So very briefly, the hypothesis was that by doing some exchange between the nursing home staff and the hospital geriatrician, we could improve some quality indicators, improve the health status of the resident, but also reduce the rate of emergency department admission. So this is the Flowchart. 175 nursing homes were involved. All the nursing homes were part of a quality improvement program, but half of this nursing home benefit of the visit of a geriatrician from the hospital during at least 2 half days to discuss what could be done to improve the network between the nursing home and the hospital. And the main result of this study was the reduction of the rate of the emergency room admission. So by just creating a network between the hospital and the nursing home, you can reduce this rate of nursing home admission, nursing home resident admission. The second intervention that we have organized in Toulouse during the past 3 months is the creation of a day hospital specifically dedicated to the nursing home residents. The problem for the nursing home staff is that they've got a low access to some exam, and most of the time they send the resident when there is an acute disease, and they cannot do they cannot do anything else than sending the patient to the emergency room. So we gave them the opportunity to send the resident to a day hospital to have the exam, to have some expertise in geriatric, and then they go back to the nursing home at the end of the day. So it's just the beginning of this activity. We have seen 138 residents at the moment. They are very old, as you can imagine, most of them are disabled, and most of them have been hospitalized several times during the past month. So this is my conclusion. I think that both the nursing home staff and the hospital should be aware that the hospitalization of a nursing home resident is something very important with a high risk of functional decline. And so if this hospitalization seems to be inappropriate, both the nursing home staff but also the hospital should think about alternative approach to avoid the bad event that can happen to this resident sent to the hospital. Thank you very much.
Thank you.